خب سلام به همه. میخوام یه مقاله بررسی کنم به اسم Long Term Antidepressant Use Patient Perspectives of Benefits and Adverse Effects که تو سال 2016 توی دوف پرس چاپ شده. اوپن اکسس هست. نویسندگانش هم از در واقع یونیورسیتی آف ایست لندن و یونیورسیتی آف آکلند، یعنی در واقع از انگلیس و نیوزیلند هستن. خب توی ابسترکتش گفته که مصرف طولانی مدت آنتی دپرسنت افزایش پیدا کرده و یه سری شواهدی وجود داره که این مصرف طولانی مدت همراه هستش با ادورس افکت، ولی در مورد پیشنس اکسپریانس و ویو آف دیس فرم آف تریتمنت اطلاع کمی داریم که بیمارا چه فکری میکنن وقتی در واقع براشون توصیه میشه که طولانی مدت دارو رو مصرف کنن. این مطالعه از متدهای مختلف استفاده کرده برای اینکه پیشنس ویو رو بررسی کنه که توی لانگ ترم آنتی دپرسنت تریتمنت چه حسی دارن، از جمله که چه بنفیت هایی میبینن و چه کانسرن هایی دارن. توی این مطالعه از در واقع 180 بیمار کمک گرفته شده که روی لانگ ترم آنتی دپرسنت یوز بودن که لانگ ترم به وقتی میگیم که بین 3 تا 15 سال، توی حالا این مقاله حتی اکثر 15 سال بوده. خیلی کلیر کات نیستش، منتها معمولا میگن تا 2 سال و بیمارانی که براشون تشخیص میجر دپرسیو گذاشته میشه یا تشخیص سیویر انزایتی دیزوردر گذاشته میشه طبیعی مصرف کنن دیگه. اگه بیشتر از اون مدت بشن لانگ ترم یوزر میشن. بعد در واقع این بیماران اکسترکت شده بودن از یک انانیموس آنلاین سروی که روی بیمارانی انجام شده بود. Experiences of antidepressant in New Zealand. Participants had completed rating scale about the effectiveness of antidepressant, level of depression before and during antidepressant use, quality of life, and perceived adverse effects. Two open-ended questions allowed participants to comment on personal experience. The majority reported that antidepressants have improved their depression, although 30% reported moderate to severe depression while on antidepressants. خب ما قاعدتا انتظار داریم وقتی که فرد داره درمان مناسب و کافی میگیره و روی آنتیدپرسنت دیگه دپرشن رو تجربه نکنه. Common adverse effects included withdrawal effects, sexual problems and weight gain. خب پس مشکلاتی که معمولاً افرادی که داشتن آنتیدپرسنت مصرف میکردن این بوده که حالا موقعی که به هر دلیلی مصرف نمیکردن علائم ویترول داشتن و در طی مصرفش هم مشکلات سکشوال داشتن و همینطور در واقع افزایش وزن. Adverse emotional effects such as feeling emotionally numb and addicted were also common. این خیلی جالبه که کمتر بهش اشاره شده که افراد احساس میکنن emotional numb هستن و یه سری هم احساس ادیکشن بهشون دست میده. While the majority of patients were pleased with the benefits of antidepressant treatment, many were concerned about these adverse effects. Some expressed the need for more information about long-term risk and increased information and support to discontinue. یعنی وقتی که در واقع این مطالعه ران شده یه سری گفتن که اگه به ما کمک کنید و اطلاعات بیشتر دید شاید این دارو رو بخوام بذارم کنار، بخاطر اینکه خیلی باش حال نمی‌کنیم و یه جوری زورکی رو توی رو درواسی روانپزشک و اینامون داریم می‌خونیم. خب antidepressant treatment can be viewed as having both short and long-term aspects, with short-term treatment including the acute and continuation phase, and long-term treatment include the maintenance phase. Increases in long-term antidepressant treatment of depression have contributed to the rise in antidepressant use. An examination of data from the United Kingdom General Practice database for the first antidepressant prescriptions between 1993 and 2005 found that the average number of prescriptions per patient doubled from 2.8 to 5.6, and a proportion of patients received on average 35 prescriptions over a 5-year period. یعنی بیمارانی که میرفتن روی مصرف آنتی دپرسن به طور کلی 35 بار در طی 5 سال نسخه میگرفتن، یعنی تقریبا سالی 7 بار نسخهشون رو تجدید میکردن. It has been argued that patients with histories of recurrent depressive episodes may require long-term or indefinite treatment with antidepressants. خب بعضی وقتا میگن که بیمارانی که هیستوری ریکارنت دیپرسیو اپیزود دارن ممکنه که لازم باشه به صورت لایف لانگ آنتی دپرسنت بخورن. Changes in prescribing guidelines have also shifted toward longer term maintenance treatment. A recent international review of 30 sets of prescribing guidelines revealed that recommendations for duration of continuation treatment varied from 4 to 12 months and maintenance treatment from 1 year to lifelong or indefinite. خب ما گفتیم که این در واقع درمان با آنتی دپرسن 3 تا فاز داره. فاز در واقع اکیوت هست که فرد در واقع درمان رو شروع میکنه و هنوز چند هفته اول 2 هفته اول خود SSRI ها معمولاً کمک کننده نیستن و کنارش یک بنزودیازپین برای آرامش بخشی میدیم. بعد یه فاز کانتینیویشن داره که معمولاً بین 4 تا 12 ماه هست تا در واقع اثر بخشی استابیلایز بشه و بعدم برای اینکه قطع میکنیم دیگه، یعنی در واقع اثر بخشی به پیکش میرسه طی 4 تا 12 ماه. یه مینتیننس هم داریم که ممکن از 1 سال تا لایف لانگ بگن دیگه باید دارو مصرف کنیم. While there is evidence for continuation of antidepressant treatment after remission, there is less evidence for maintenance or long-term treatment. خب ممکنه که در واقع بعد از اینکه وارد رمیشن شد ما بگیم که حالا 4 تا 12 ماه مثلا این دارو رو مصرف کن، ولی این که بگیم که مینتیننس یا لانگ ترم تریتمنت بذار خیلی شواهد وجود نداره. While most cases of depression are managed through primary care, a recent review revealed that no randomized clinical trial have been conducted to evaluate the efficacy of long-term treatment in primary care. However, a review of 14 naturalistic studies of long-term treatment for depression over 10 years found that outcomes for depressed patients were poor, with multiple relapses and large variability both within and between individuals. میگه کلا بیمارانی که وارد فاز مصرف طولانی مدت آنتی دپرسنت میشن ممکنه که در واقع هم ریلپس داشته باشن، هم اینکه آوتکام پورتری داشته باشن، همین که در واقع بین فرد با فرد فرق میکنه، هم توی یه فرد ممکنه خب یه دوره‌هایی این قضیه اوکی تر باشه، یه دوره‌هایی نباشه. Patients in non-drug treated samples didn't show worse outcomes while some had superior outcomes. Furthermore, a study of antidepressant use over 2 years in primary and secondary clinical care found high rates of recurrence in patients continuously using adequate dose of antidepressant. خب میگه طبیعتاً روش‌های مثل CBT و سایکولوژیکال تریتمنت ها که جای خودشون دارن خیلی ارزشمندن، ولی درمان آنتی دپرسنت دراگ تراپی ریت ریکارنس بالایی داشته. وقتی که به صورت لانگ ترم استفاده شده patients not treated with antidepressant after remission had the lowest recurrence rate. میگه بیمارانی که بعد از اینکه رمیشن داشتن دیگه دارو رو قطع کردیم و ادامه ندادیم از قضا خیلی دچار ریکارنس نشدن. اونایی که بعد از اینکه رمیشن داشتن دارو رو طولانی مدت گفتیم ادامه بدین دچار رمیشن شدن. A recent investigation of patient-perceived side effects in the Netherlands found that 63% of patients reported on average 2.9% side effects during the 1-2 years of follow-up period. The researchers used a 12-item shortened version of the antidepressant side effect checklist that included insomnia, sleepiness during the day, restlessness, muscle spasms, twitching, dry mouth, profuse sweating, sexual disorders, nausea, constipation, diarrhea, weight gain and dizziness. خب میتونیم خیلی از اینا چه توی ساید افکت مصرف طولانی مدت دارو وجود داره چه وقتی که داریم دارو رو قطع میکنیم. The most frequently reported side effects for SSRIs were dry mouth, profuse sweating, sexual dysfunction and weight gain. Two recent reviews of research in the area concluded that discontinuation affects sexual dysfunction, weight gain and sleep disturbance are adverse effects of long-term SSRI use. خب این دقیقاً اون چیزیه که من از این مقاله میخواستم، بخاطر اینکه بجز توی مقالات خیلی بهش اشاره نشده که گفتن در واقع وقتی ما لانگ ترم SSRI یوز داریم ویت گین خواهیم داشت، اسلیپ دیستربنس خواهیم داشت و sexual dysfunction. There is also increased risk of osteoporosis and fracture, bleeding disorders, hyponatremia and diabetes mellitus. این هم که چیزای جالبی. خب طبعا وقتی ما به سمت سندروم متابولیک و افزایش وزن بریم دیابتیک ریسکش زیاد میشه. بلیدینگ دیزوردر رو خودم من تجربه کردم. هایپوناترمی هم در واقع SIADH مرتبط با SSRI یه حس شناخته شده است. It's also important to note that qualitative research has revealed a range of emotional adverse effects that are not investigated in the majority of studies, including the study mentioned earlier. A literature review of research into patients' perspectives of antidepressants found that these included sedative type effects, emotional blunting, and emotional instability. خب اینا باز از ادورس افکت های مصرف SSRI هست که خیلی جالبه، کم در موردش بحث شده و در واقع sedative type effect دارن، emotional blunting دارن و emotional instability. These adverse effects are often not investigated and are not mentioned both on drug packaging and in advertising. Hence, adverse effects that impact emotional well-being are often ignored. که این دقیقاً یه مشکلی است که وقتی ما SSRI مصرف بکنیم و دچار اینا بشیم ممکنه فکر کنیم که این خودش به خاطر اینه که در واقع رزیجوی اون دپرشنی هستش که فرد داشته و بخوایم حتی در واقع دارو دوزش رو بالا ببریم یا اینجور چیزا که اینو درمان کنیم، در حالی که باید بدونیم این ممکنه به خاطر خود دارو باشه. The data for this study came from a large online survey of patients' experiences of antidepressants in New Zealand با تعداد patient population 1829 نفر. This survey aimed to gain insight into patients' perspectives of antidepressant medication. Approximately 50% of participants reported being on antidepressants for more than 3 years. Those who had used antidepressants for more than 3 years reported more severe side effects, including weight gain, addiction, feeling not like myself, withdrawal symptoms, and suicidality than those who had been on antidepressant for less than 2 years. خب البته اینجوری که این اطلاعات پرزنت شده شاید نشه خیلی راحت نتیجه گیری کرد. گفته به هر حال این weight gain, addiction و feeling like not myself و withdrawal symptoms و suicidality توی افرادی که بیشتر از در واقع 3 سال مصرف میکردن بیشتر بوده تا کسایی که کمتر از 2 سال مصرف که حالا معلوم نیست به خاطر اینکه بیماریشون شدیدتر بوده یا به خاطر ساید افکت دارو، که البته ما داریم اینجا تلاشمون رو میکنیم که بگیم این به خاطر ساید افکت دارو هستش. خب A little is known about patients' perspectives on long-term antidepressant use. To gain insight into patients' experiences of the benefits and problems associated with this form of treatment, this study examines the experiences of patients who participated in the New Zealand survey and first began using antidepressant in the 1997 to 2001 period. It asks the following questions. What are the patient perceived benefits of long-term antidepressant use? What are the patient perceived risk or concerns about long-term use? خب در واقع میخواد بگه وقتی ما به بیماری میگیم لانگ ترم مصرف کنه چه چیزای خوبی به دست میاره و چه چیزایی رو هم از دست میده. خب از چه متدی استفاده کرده؟ Ethics approval was given for the original survey by the University of Auckland Human Subjects Ethics Committee. The original anonymous online survey was advertised through the New Zealand media. Consent was indicated by participants in the anonymous survey. Criteria for participation included having used an antidepressant in the previous 5 years and being 8 years of age and older. Participants completed rating scales including level of depression before and during antidepressant treatment, perceived effectiveness of antidepressant, perceived impact on the quality of life, and perceived adverse effects. خب تو این زمینه‌ها پس سروی هایی رو انجام دادن بیماران. The survey also contained open-ended questions. These included the following. خب یه سری هم سوال open end داشته که خود بیمار هر چی دلش بخواد بنویسه. Could you please complete this sentence or paragraph? In my life antidepressants have been. و سوال بعدی هم if there is anything you'd like to say about your experience of antidepressant, please write about this in the box below. Researchers have used various criteria in the study of long-term antidepressant treatment, including 18 months, 2 years, and more than 10 years. پس در واقع طبقه بندی کردن اونایی که لانگ ترم مصرف میکنن به کسانی که 18 ماه مصرف میکردن یا بیشتر، 2 سال یا بیشتر و 10 سال یا بیشتر. The original survey provided a series of options in terms of the length of antidepressant use. The maximum available to participants was more than 3 years. To assess a subgroup of participants who had used antidepressant for longer term, the criteria for participation in this study were having begun antidepressant treatment between 1997 and 2001, having used antidepressant 5 years before completing the survey, and having used antidepressant for a minimum of 3 years. Participants in the original and current study who reported using medication that were not antidepressant were excluded from the study. خب اینجا مشخصات دموگرافیک پارتیسیپنت ها رو میخواد بگه. The participants in the study were 180 adults. Of those, 149 were prescribed antidepressant by their general practitioner and 31 by psychiatrist. خب اینم که جالبه بدونید که طبیعتاً توی استرالیا جی پی پرایمری کیر حتی بیماران دپرسیو یا بیماران نوروتیکی دیگر رو انجام میده و بیشتر افرادی که در واقع براشون تراپی شروع شده توسط جی پی شروع شده براشون، نه از سایکیاتریست. Some participants noted in their written comments how many years they have been on antidepressant. The available data indicates that the participants in this study were on antidepressant medication for an average of 3 to 15 years. The most commonly prescribed antidepressants were citalopram, venlafaxine, paroxetine, fluoxetine, loxamine, and nortriptyline. جالبه که سرترالین جزوشون نبوده. خب اینم که در مورد ایج گفته 18 تا 25 سال یه نفر بوده، 26 تا 35 سال 45 نفر، 36 تا 45 54، 46 تا 55 50، 56 تا 65 25، بیشتر 66 سال هم 5 نفر، 143 نفر فیمیل بودن، 37 نفر میل بودن و در حال حاضر در حال مصرف آنتیدپرسنت باشن 151 نفر، در حال مصرف نکرده باشن 29 نفر. خب analyze data. Descriptive statistics were calculated for the quantitative data from the rating scale using IBM SPSS statistics for Windows version 20. Qualitative data from both open-ended questions were combined. All participants answered the first questions and 108 participants the second. A categorical analysis based on the methods described by Bowling was conducted on the qualitative data. All the data were read and reread to develop an understanding of the views and experiences expressed. Patterns were examined in the combined dataset by the first, fourth, and fifth authors independently. Three main categories of response were identified by each of the authors. These included a category of positive statements about the benefits of antidepressants, a category of a statement about the problematic aspects, and a third category of a statement regarding other concerns and preferences. These were further examined by subcategories. The data were then entered into SPSS 20 and the frequencies for each category and subcategory were calculated. حالا results چی بوده؟ گفته As can be seen from table 2, the respondents reported an overall improvement in level of depression and quality of life while on antidepressant, although 30.7% reported moderate to severe depression while on antidepressants. خب این تیبل 2 هستش که در واقع level of depression in year before taking antidepressant، یعنی قبل اینکه شروع کنن تو چه وضعی بودن و اینکه آیا این antidepressant کمکی بهشون کرده یا نه، و quality of lifeشون وقتی داشتن antidepressant مصرف میکردن چی بوده. 53% گفتن greatly improved، 31% گفتن slightly improved، 2.8% گفتن unchanged، 2.2% گفتن یکم بدتر شده، 5% هم گفتن خیلی بدتر شده. خب این خودش چیز جالبیه که ما اینا رو هم ببینیم. و level of depression while taking antidepressants گفته وقتی antidepressant گفتن اصلا depression نداشتن 9.6%، خفیف 49.7%، moderate 21.8% و severe 8.9%. خب adverse effect ها were reported by more than half of the participants. The 5 most commonly selected adverse effects were withdrawal effects, sexual dysfunction, weight gain, feeling emotionally numb, and failure to reach orgasm. Between 36% and 57% of respondents experienced these adverse effects at either moderate or severe level. Participants are also reported a number of other emotional effects, included feeling not like myself, reduced positive feeling, caring less about others, and suicidality. Qualitative analysis. As outlined in the methods section, the main categories of response were defined from the analysis of the combined qualitative data set. یعنی در واقع میخواد بگه بجز این که حالا ما پرسشنامه و کوانتیتیتیو دادیم، یه سری سوال کوالیتیتیو هم پرسیدیم. اول در مورد این تیبل که بالاتر اشاره کرد بگیم که در واقع بیماران نسبت به این adverse effect چه امتیازی دادن. withdrawal effects 16% گفتن ما خفیف داریم، 23% گفتن moderate و 33% گفتن severe. sexual dysfunction باز توضیحش تقریبا همینجوریه. weight gain تقریبا همینجوریه. feeling emotionally numb. failure to reach orgasm. این failure emotional numbness چیز جالبیه اینجا من هایلایت میکنم چون خیلی کم بهش توجه شده. agitation, drowsiness, feeling not like myself اینم باز چیزیه که بهش کم اشاره شده. dizziness, reduced positive feeling اینم باز چیزیه که بهش کم اشاره شده. addiction, headaches, caring less about others, suicidality, nausea, tremors, feeling aggressive, diarrhea این خیلی جالبه، یعنی احساس خشم داشتن. دیاریا و ویت لاس. خب ما میدونیم که در واقع میتونه باعث کاهش اشتها بشه SSRI ها، ولی میتونه باعث افزایش وزن هم بشه. حالا بریم سراغ در واقع اون قسمت qualitative. They help me to cope with life. Just over 2/3 of participants wrote that antidepressants had helped them to get by or cope, and around 1/5 thought that they had functioned well as a result of being on an antidepressant. As one participant said, a necessary part of life that makes it easier to cope with the dramas that life gives me. خب منظورش اینه که این necessary part همون SSRI ها بوده. Over the past few years, I have experienced several major life events. I do not think I would have coped with these events without the use of antidepressants. خب پس 2/3 و به بالا اینجوری توصیف کردن. One woman talked about her perception that the antidepressants help her to have a normal life. In my life, antidepressants have been very useful. I am now a very functional human being and can lead an absolutely normal life with no problem whatsoever. خب حالا اونایی که problem داشتن. In this category, participants wrote mainly about a long process of finding an antidepressant that worked, problems with discontinuation, the negative impacts of antidepressant on views of self and other adverse effects. خب یه مشکلی که طبیعتاً بیمارانی که SSRI مصرف میکنن دارن اینه که تا در واقع یک SSRI رو پیدا کنن که به قولی بهشون میسازه، یعنی adverse effect کمتری داره و در اثرات مثبت براشون داره، طول میکشه و اینو اومدن از بیماران اینجا پرسیدن. خب اینجا هم یه تیبلی آورده در واقع از categories of qualitative responses، یعنی اونایی که مثلا خوب گفتن، بد گفتن، یا در واقع یه چیزایی گفتن که نامرتبطه. گفته 64% افراد گفتن که antidepressant ها help to get by، وقتی که در واقع مشکل داشتن کمکشون کرده، یعنی که فقط مثلا بگذرونن زندگیشون، و 21% هم گفتن که اصلا خیلی حال داده و باعث شده من فانکشن ول بکنم. بعد گفته 21% افراد مشکلات ویتراول رو تجربه کردن باهش، 17.8 ایمپکت روی سلفشون داشته، 18.3% گفتن پروسس طولانی بوده تا بخوان یه داروی موثر پیدا کنن، 8.9% گفتن این افکتیو بوده، 6.1% گفتن اصلا کار نکرده، 4.4% گفتن زندگی رو بدتر هم کرده و 18.9% گفتن ادورس افکت های دیگه ای داشته. بعد 26% افراد اشاره کردن که خوبه که آلترناتیو تریتمنت هم حتی کنارش گرفته بشه. 11% گفتن که اطلاعات بیشتری در مورد SSRI نیاز دارن که بلد نیستن، الان ندارن اون اطلاعاتو. و 15.6% به prescriber roles اشاره کردن. 11% افراد هم گفتن که دلشون میخواد قطع کنن SSRI رو. Some participants talked about the years it took to find an antidepressant that was effective for them. It did, however, take many years of trying different tastes of antidepressant before I found one that seemed to work for me, and how few side effects or side effects that were manageable. As noted earlier, 74% of participants reported problems with withdrawal symptoms, and 21% wrote about problems with withdrawal in the open-ended questions. Some commented that they had not been informed about the difficulties of withdrawing from antidepressant after long term. خب طبعا وقتی لانگ ترم مصرف کنیم ویدراوال هم پروسه طولانی خواهد داشت، منتها اون موقعی که داشته درمان طولانی مدت بهشون پیشنهاد می شده بهشون نگفته بودن بعدن اگه بخوای از این طولانی مدت کنار بری چقدر سخته. I was never informed by doctors of long-term side effects or addiction, development of tolerance, and went through extremely severe withdrawal symptoms attempting to get off suicidal level depression only by persisting through terrible suffering did I wean myself off. Some felt unable to discontinue antidepressant treatment as a result. For the woman below, this resulted in a lack of options with regard to managing her depression. While there is no doubt I'm better on this medication, the adverse effects have been devastating. When I have tried to withdraw from head zaps, agitation, insomnia and mood changes. خب پس این مشکلات داشته وقتی که میخواسته withdraw کنه. This means that I do not have the option of managing the depression any other way because I have a problem coming off the medication. میگه بخاطر اینکه دیگه نمیتونم دارو رو تحقیر، یعنی حتی خودشو ناتوان میبینه برای اینکه یه مدتی اینا رو بتونه تحمل کنه. واسه همینم میگه دیگه احتمالاً ناچارم تا آخر عمرم بخورم که اینجوری ویتراول نکشم. Some talked about the ways in which taking antidepressants impacted their views of themselves. This included feeling abnormal for needing an antidepressant and having difficulty knowing what is actually me as opposed to the effect of antidepressant. بعضی‌ها میگن نمیتونستن مرز بین خودشون و آنتیدپرسان رو پیدا کنن. بعضی‌ها میگفتن که احساس میکردن که غیر طبیعی‌ان که نیاز دارن آنتیدپرسان بخورن. من خودم تقریبا هر دو تا اینا رو داشتم. I have been on them for so long now that I'm not sure how much of myself is actually me and how much is the antidepressant. One woman wrote about a number of these concerns, including the impact of long-term use on her brain. Have now been taking SSRIs for better part of 15 years. Whatever I try to stop, I find I relapse or experience withdrawal symptoms. I worry that my brain chemistry has been permanently affected, so I now feel I cannot be normal without them. I try to get off them, but can't seem to do it no matter how slowly I wean myself off. این حتی میگه اگه تیپرم بکنم نمیتونم باز مقابله کنم با عوارض منفیش. Other adverse effects written about by participants included increase in numbing or emotional bluntness, suicidality, weight gain, and sexual problems. Sometimes I have been told to take, but I do not like them. Something I have been doing. یعنی دوست ندارم مصرف کنم ولی بهم گفتن بعد مصرف کنی. They numb all your feelings, both positive and negative. I have been permanently damaged sexually by the drug. I have tried numerous antidepressants with severe side effects. When on some of them my mood has lowered to feeling suicidal. Beyond antidepressants, participants reflected on a number of concerns, including the importance of receiving therapy, the need for accurate and full information about long-term use, and the role of prescribers. Of these participants, 26% wrote about alternatives to antidepressants. Some commented that antidepressants are not the only alternative that can help with recovery. از جمله اینا رو نوشتن. Antidepressants are seen as a cure-all, and this forgets all the other things that help. Antidepressants in combination with moderate amounts of exercise, flexible working hours, meditation, mindfulness, and supportive relationships are key for me to maintain wellness in my life. 30 participants, yani 17%, also wrote about the importance of therapy or counseling as part of their treatment. As the participant below said, I believe the antidepressant helped, but I needed a counselor to help me work through some of the causes. I had been depressed on and off since teenage years. CBT has given me the skills to cope with life on a daily basis without drugs. Of course, most of the time. بعضی وقتا نمیتونه کوپ کنه یا خلاصه به دارو هم نیاز داره. I believe that I did have depression and that it was a result of a series of stressful experiences over a long duration. Affordable access to a psychologist would have negated the requirement for medication. What resolved my depression in the end was visiting a psychologist regularly over a couple of years. This was very expensive but worth it. خب طبیعتا اونجا هم در واقع مدیکی رو حالا بیمه ها ساپورت نمیکنن سایکولوژیکال سشنز رو، در نتیجه خیلی براشون گرون خواهد بود مثل همین ایران. Some also expressed frustration that the therapy was not more easily available, as one prescriber who had used antidepressants said, unfortunately there is great difficulty and cost in getting alternative therapies such as good quality CBT. It's cheaper, easier and more convenient to reach for the prescription pad. I know this because I am a prescriber. خب این میگه که خودش احتمالاً یا پزشک بوده یا خلاصه مدیکال استاف بوده و دارو دادن راحت تر از اینه که یه مثلا CBT کار خوب پیدا کنی و بتونی باش ادامه بدی. As well as writing about alternatives to antidepressants, some participants commented on valuing the general practitioner's role. Others commented on the lack of information that was provided on long-term effects, including withdrawal effects. I was never fully informed of all side effects, short or long term. I have kept the information I received when prescribed, when is minimal basic. I'm now only this and last year finding out the permanent damage from medication that the prescriber knew about but didn't tell me. If I had been more fully informed, I would not have taken the medication for a long time or at all. There is a lack of consumer-based information of personal experiences of antidepressants, especially coming off and what's happening when an adverse relapse condition kicks in. That is how to withdraw safely. Also, lack of info on long-term physical effects of staying on antidepressants. خب اینا همه یه حرف مشترکی زدن که اطلاعات کافی در مورد مصرف لانگ ترمش نداشتن و اگه داشتن حتی ممکن بود وارد درمان نمی شدن. Comments also addressed the perceived need for more support from prescribers with regard to discontinuation of antidepressants. The difficulty of getting off has been a tough road and taken me years of trying, and is something that doctors could be more knowledgeable of and supportive with. خب یه مشکل خیلی شایعی که دارن در واقع با ترک قطع دارو هست که خیلی ویتراول اذیت کننده داره و اینجا گفته که در واقع اکثرا ساپورت زیادی میخوان، ممکنه چندین بار تلاش کنن و نتونن قطع کنن و اینجور چیزا. The majority of patients in this study believed that antidepressants alleviated their depression and improved their quality of life to some degree, although 30% reported moderate to severe depression while using antidepressants. As report in 2030, experiences of adverse effects were common. However, Beth et al.'s study didn't examine the adverse emotional effects reported in this study, nor did it examine the patient's reports of withdrawal symptoms. Some patients in this study were particularly concerned about severe withdrawal symptoms that undermined their confidence to discontinue should they wish to, and therefore limited their choices. In line with these, 45% patients also believed that they had some level of addiction to the antidepressant. Some patients were also critical of the lack of information given by prescriber with regard to adverse effects, including withdrawal symptoms. Some also expressed disappointment or frustration with the perceived lack of support available to them in managing withdrawal. A previous study of patients' beliefs regarding adherence to antidepressant maintenance treatment by Hafter found that adherence was higher when the perceived need exceeded concerns about safety, and lowest when concerns exceeded perceived need. In this study, some patients reported adhering to treatment because of safety concerns linked to withdrawal symptoms rather than a perceived need for the antidepressant per se. یعنی میگه یه سری دلیلی که دارن دارو ادامه میدن بخاطر اینکه نمیتونن قطع کنن، نه اینکه واقعا نیازی داشته باشن. Finally, approximately 25% wrote about the alternative activities and treatments that they believed could aid recovery. من فکر میکنم خیلی تعداد بیشتری باشن که در واقع به CBT ارزش بیشتری از دراگ تراپی بدن، ولی فقط 25% توی مطالعه اشاره کرده بودن. 1 in 6 wrote about their perceptions of the importance of therapy or counseling either as an alternative to or in combination with antidepressant medication. strengths and limitations. خب اینم که مطالعه چه نقایص و قدرت‌هایی داشته. implication for practice که ما باید چی کار کنیم؟ خب طبیعتا این مشکلات رو نداشته باشیم، اطلاعات بیشتر داشته باشیم، با بیمار بیشتر شیر کنیم، درمان‌های ارجمند رو معرفی کنیم و اینا. خب در مجموع مقاله جالبی بود، امیدوارم خوشتون اومده باشه. چند تا مقاله دیگه هم هست شبیه این که میخوام بررسی کنم. خودم این مقاله رو دوست داشتم. فعلا خدا نگهدار.